Dear viewers, today we're going to talk about a very important topic, something you may never have thought about in your life, but something you do every night for 6, 7, 8 hours, and its effect on your brain health. Now I want to ask you a question. Do you wake up tired in the morning? Do you wake up multiple times throughout the night? Or worse, have you noticed that your memory isn't as sharp as it used to be in recent years? Maybe you're struggling with concentration. Maybe you've accepted that your brain is aging. They told you it's a natural process that comes with age. It happens to everyone. There's nothing you can do about it. But what if I told you that this is completely wrong? What if I told you that sleeping in the wrong position every night is silently poisoning your brain? Yes, you heard right. Poisoning it. Look, for years, the medical world considered sleep position to be an insignificant choice. If you sleep comfortably, you're sleeping correctly, they said. But research over the past decade, especially groundbreaking work in neurology and sleep science, has completely overturned that understanding. And today, by the end of this video, you'll understand the critical impact your sleep position has on your brain health. You'll learn which position protects your brain and which one unknowingly harms it. And most importantly, you'll know exactly what to do when you go to sleep tonight. First, we need to understand this. What does your brain do while you sleep? Most people view sleep as a passive process. As if the body shuts down, the brain stops, and we turn back on in the morning. But this is far from the truth. During sleep, your brain works intensely to clear toxins that have accumulated throughout the day. We call this the glymphatic system. This system allows cerebrospinal fluid to flow through the brain tissues, removing harmful waste products such as beta-amyloid and tau proteins during this flow. In this study conducted on mouse models, it was found that when animals slept in a side-lying position, the glymphatic system worked much more efficiently compared to back or face-up positions. The rate of toxin clearance was significantly higher in the side-lying position. Hold on a minute. This is a study done on mice, you might say. Isn't the human brain different? Individuals who regularly sleep on their side showed a 23% reduction in the risk of cognitive decline compared to those who sleep on their back or stomach. They performed better on memory tests, attention tests, and problem-solving skills. 23%. That's not a small number. Protection you can achieve without taking any medication, without undergoing any treatment, simply by changing your sleeping position. So why? Why is the side sleeping position so effective? There are several mechanisms at play. First, the effect of gravity. When you sleep on your side, the flow of cerebrospinal fluid is most efficient. The glymphatic channels are most open in this position. Second, airway obstruction. Especially in individuals over the age of 65, lying on your back can cause the airway to narrow. This leads to sleep apnea or hypoventilation, and individuals with sleep apnea cannot send enough oxygen to their brains. Chronic oxygen deprivation causes damage to brain cells. Third, gastroesophageal reflux. When lying on your back, there's an increased risk of stomach acid escaping into the esophagus. This acid reflux reduces sleep quality, causes frequent awakenings, and prevents the transition to deep sleep phases. Deep sleep phases are when the lymphatic system is most active. Now, I will explain the 3 basic sleeping positions from least to most effective and their effects on your brain health. I will share the advantages and disadvantages of each, and if you have to sleep in that position, what you can do to minimize the harm. Let's start with number 3, sleeping on your stomach. This position is the most problematic for brain health, and unfortunately, many people have gotten used to sleeping on their stomachs throughout their lives. What happens to your brain when you sleep on your stomach? First, your cervical vertebrae twist unnaturally. When lying on your stomach, you have to turn your head to one side to breathe. This position puts pressure on the cervical vertebrae and can compress the vertebral arteries that run through them. These arteries carry blood to the brainstem and cerebellum. Chronic compression reduces blood flow to these areas. Second, lying face down compresses the rib cage. Diaphragm movement is restricted and breathing depth decreases. Shallow breathing means lower oxygen saturation. And your brain is the organ in your body that needs the most oxygen. Third, Intracranial pressure, or pressure inside the skull, increases when lying face down. Extra pressure is placed on the brain, and this pressure slows down glymphatic flow. So, what should you do if you've been sleeping on your stomach for years? The first step is awareness. If you're watching this video, you're already aware. Now you need a transition strategy. Many experts recommend a gradual transition rather than an abrupt change in position. You can prevent yourself from turning onto your stomach during the night by placing pillows around your body. You can transition to a half-prone, half-side position by placing a thin pillow under your chest. Also, remind yourself before going to sleep, "Tonight, I will sleep on my side." This simple intention setting is surprisingly effective. The brain remembers this intention even during sleep and guides you in changing positions. Moving on to number 2, the supine sleeping position. This position is generally recommended from an orthopedic standpoint. It keeps your spine straight, puts no pressure on your joints, and prevents wrinkles on your face. But when it comes to brain health, things get a little more complicated. The biggest risk of sleeping on your back is the development of obstructive sleep apnea. In individuals over the age of 65, tongue muscle tone decreases. When you lie on your back, gravity pulls your tongue backward and narrows or completely blocks the airway. An individual with sleep apnea stops breathing dozens, even hundreds of times throughout the night. Each time this happens, the brain sounds an alarm, partially waking the person, but they do not remember this in the morning. These micro-awakenings disrupt deep sleep phases and hinder the efficient functioning of the glymphatic system. A study conducted at Johns Hopkins University showed that untreated moderate sleep apnea can reduce the brain's waste removal capacity by up to 40%. This means an acceleration in beta-amyloid accumulation. It means an increased risk of Alzheimer's disease. But wait, sleeping on your back isn't bad for everyone. If you don't have sleep apnea, are at a healthy weight, and have no structural problems in your airway, sleeping on your back is an acceptable option. The glymphatic system, while not as efficient as when lying on your side, is still functional. So what should you do if you prefer to sleep on your back? First, use a pillow that elevates your head. But be careful, you should slightly elevate your upper body as well, not just your head. Otherwise, you will strain your neck muscles. Wedge-shaped pillows designed for this purpose are available. Second, recognize the symptoms of sleep apnea: excessive daytime sleepiness, morning headaches, nighttime snoring, breathing interruptions. Your partner or bedmate may observe that you stop breathing during the night. If you experience any of these symptoms, be sure to consult a sleep clinic. Third, maintain your ideal body weight. Excess weight increases fat tissue around the neck and raises the risk of airway obstruction. And now we come to number 1, the side-lying position. The most ideal position for brain health. But there are important details to pay attention to here as well. Because lying on your side can be done in different ways, and not all of them are equally beneficial. First, you should ask yourself whether to lie on your left or right side. Interestingly, research shows that sleeping on your left side offers some additional advantages. For example, as you know, the heart is located on the left side of the chest. When you lie on your left side, gravity helps the heart pump more easily. Blood circulation works more efficiently, and blood flow to the brain is optimized. Now I will list the critical points you should pay attention to when sleeping on your side. First, neck alignment. Most people use either too high or too low pillows when sleeping on their side. This causes the cervical vertebrae to curve. The flow of cerebrospinal fluid through the spinal cord is disrupted. Moreover, tension builds up in the neck muscles, and you wake up with neck pain in the morning. The ideal pillow height should be thick enough to keep your head aligned with your spine. When lying on your side, your nose should be in line with your sternum. You can check this by looking in a mirror or having someone take a photo. Second, knee position. When lying on your side, your knees come on top of each other, which can cause pressure on the hip joint. This pressure can affect blood circulation in the lower body. The solution is simple. Place a pillow between your knees. This keeps your hips in a neutral position, reduces lower back tension, and allows you to sleep more comfortably throughout the night. Third, shoulder position. When lying on your side, All your weight rests on one shoulder. This can cause compression and pain in the shoulder joint. This can be a serious problem, especially for individuals with shoulder problems. As a solution, use a mattress that is not too firm. The mattress should allow your shoulders and hips to sink in slightly. Also, when lying down, pull your shoulder back and slightly open your chest. This reduces pressure on the shoulder joint. Fourth, mattress firmness. Mattress selection is critical for individuals over the age of 65. A mattress that is too firm causes pain at pressure points and forces you to constantly change positions throughout the night. This disrupts deep sleep phases. A mattress that is too soft, on the other hand, disrupts spinal alignment and causes muscle tension. A medium firm mattress that conforms to the body's natural curves is ideal. Now, I'm going to tell you something very important. Sleep position alone is not everything. General practices we call sleep hygiene also affect your brain health. You can shape sleep quality not only with position, but also with pre-sleep routines, room conditions, and sleep patterns. Now, I want to share a few of these with you. Room temperature. During sleep, the brain tries to lower body temperature. This drop triggers melatonin release and facilitates the transition to deep sleep. Your room temperature should be between 18 to 20 degrees. Many people, especially in winter, overheat their rooms. This reduces sleep quality and decreases lymphatic system efficiency. Darkness. Melatonin is a hormone secreted in the dark. If there is any light source in your room, and even the standby light on the TV, melatonin production is suppressed. Use blackout curtains. Remove electronic devices from the room or turn off their lights. Blue light exposure. Using your phone, tablet, or computer before bed exposes you to blue light. Blue light sends a daytime message to the brain and makes it difficult to fall asleep. I recommend staying away from screens at least an hour before bedtime. Caffeine. Caffeine has a half-life of about 6 hours, so half of the coffee you drink in the afternoon may still be circulating in your blood at midnight. In individuals over the age of 65, caffeine takes even longer to metabolize. Avoid caffeinated beverages in the afternoon. Alcohol. Many people think alcohol helps them sleep. Yes, alcohol can help you fall asleep faster, but alcohol disrupts REM sleep. REM sleep is critical for memory consolidation and brain repair. After a night of drinking, even if you've slept, your brain hasn't rested sufficiently. Now I want to share a personal experience with you. For years, I slept on my back. It was described to me as the most orthopedically correct position. But in my mid-60s, I went through a period where I started waking up more tired in the mornings. I noticed small lapses in my memory. I would have to pause for a second to remember a patient's name. I would forget the time of a meeting. When I did this research, I decided to switch to sleeping on my side. I admit that the first few weeks were difficult. I would find myself on my back in the middle of the night, but I persevered patiently, using pillow barriers. After 2 months, I noticed that I was waking up more rested in the mornings, that mental fog had disappeared. My concentration had improved. Of course, this is not scientific proof, just one person's experience. I want to tell you this, it's never too late to make this change. You can make this change at 65, 75, or 85. Brain plasticity, or the brain's capacity to reorganize itself, continues throughout life. If you provide the right conditions for your brain, it will respond. Now, I want to answer some frequently asked questions. Is it normal to change positions throughout the night? Yes, it's completely normal. In fact, it's necessary. Staying motionless in the same position can cause pressure sores and blood circulation problems. The average adult changes position 10 to 20 times throughout the night. The important thing is not that you wake up on your side, but that you spend most of your sleep time on your side. Which side should I sleep on? Always the same side? Sleeping on the same side all the time can cause pressure on the shoulder and hip joints on that side. Ideally, you should turn to both sides throughout the night. Your body will do this naturally. If you feel pain on one side, switch to the other. My partner snores and wakes me up. What should I do? Sleeping next to a partner who snores affects your sleep quality. A partner's snoring is often related to sleeping on their back. Encourage them to sleep on their side. If the snoring persists, it is important to have them evaluated for sleep apnea. Some couples choose to sleep in separate rooms to maintain sleep quality. This does not harm your relationship. On the contrary, it ensures that both of you are more rested. I use sleeping pills. Does this affect my brain health? Most sleeping pills affect deep sleep phases. Some suppress REM sleep, while others reduce glymphatic system activity. Long-term use of sleep medication has been linked to a risk of cognitive decline. Behavioral interventions, sleep hygiene adjustments, and cognitive behavioral therapy should be considered for medication-free sleep. But let me also say this: not sleeping at all is worse than sleeping with medication. If you are taking medication, do not stop without talking to your doctor. Dear viewers, before ending this video, I want to ask you for something. Tonight, try sleeping on your side. If you already sleep on your side, pay attention to your neck and knee alignment, review your pillow, adjust your room temperature. Small changes make a big difference, and after 4 weeks, evaluate yourself. How do you feel in the mornings? Is your mind clearer? Has your energy increased? Share these changes with me in the comments. I read every comment and respond as much as possible. Remember, brain health is a choice. The small choices you make every night shape your cognitive capacity 10 or 20 years down the line. The steps you take today are the greatest gift you can give your future self. If you found this video helpful, don't forget to like it and subscribe to the channel. Wishing you healthy and restful sleep.